If you have ever dealt with a nagging joint issue like knee pain that aches every time you use the stairs, or a stubborn tendon that simply won't budge despite months of rest, physio and painkillers, you know how frustrating it is to feel stuck. To understand why you are stuck, we have to look at how your body handles damages. When you get a fresh cut, a small cell fragment in your blood called platelets rush in. They are the nature's body's first responders. Once they arrive at the scene, these platelets will release chemical signals called as growth factors. Think of growth factors as localized alarm system that tells the surrounding tissue to wake up, start dividing and repair the damage. But with chronic long-term wear and tear, the natural alarm system eventually turns off. The body gets used to the ongoing damage, essentially forgetting the injury is there and stops sending those vital responders. You end up stranded up on a healing plateau. The injured joint or tendon is physically isolated and it simply lacks the biological rescue team requiring to finish fixing it. This is where the platelet-rich plasma or PRP therapy comes in. It's a medical technique designed to manually drop highly concentrated rescue squad directly into the stubborn injury. The process begins very simple. A doctor draws a small standard volume of blood from a vein in your arm, much like a routine checkup. The tube goes into a machine called as a centrifuge, which spins the blood rapidly and separates it out into three distinct bands. Heavy red blood cells sink, clear plasma sit on the top, and the thin layer gets trapped in the middle. Taking a closer look at the middle band, it is densely packed with isolated first responder platelets. This entire process is a closed loop system. The blood never leaves the room or gets sent away to an external lab. It stays in a sterile environment the entire time. It's just a matter of minutes your own blood is concentrated into a customized healing serum that is ready for development. To deliver the serum, doctors often use an ultrasound machine. This gets them beneath the skin, ensuring that they inject the platelets with pinpoint accuracy directly into the damaged tendon or joint space. Because we are relying entirely on your own biology for this to work, there are some strict rules to make sure that you are safe and effective candidate for therapy. For example, no active infection, no blood clotting disorder, or an unusually low platelet count. If your natural responder force is already depleted or fighting a major battle elsewhere, we cannot effectively concentrate it. This schematic shows another strict requirement, passing anti-inflammatory drugs like Ibuprofen 5 to 14 days before the procedure. These medications work by binding to a platelet and freezing it in tracks, effectively putting your rescue team to sleep. Before you prepare your body correctly, just make sure that it is very critical for the injection itself. We need to ensure that when those first responders arrive, they are fully awake and ready to work. Right after the injection, you should expect the area to feel a little bit angry. Over the first 24 to 72 hours, it is normal to experience some temporary pain, stiffness, or local swelling at the injection site. Try to use this temporary discomfort as a good sign. It is a physical proof that the responders have arrived, set off biological alarm, and are actively triggering the chain reaction required to start healing. Rebuilding biological tissue is a slow, steady process. You will not feel cured in few days. Noticeable improvement in pain and mobility typically begins after 3 to 4 weeks. The standard protocol usually involves 1 to 3 staggered injection. For patients who respond well, the resulting benefits can persist up to 12 months' time. Clinical trials show strong promising results for reducing pain in conditions like osteoarthritis and tennis elbow. For other injuries, the data is still emerging and the results can vary from person to person. PRP provides a targeted way to harness and concentrate your body's own healing mechanism to finally overcome stubborn pain.